I wanted to be a pediatric oncologist because it married many of my interests. I've always been interested in taking care of children. I've always been interested in science and medicine and wanted to be in a field where I was taking care of a difficult disease. So pediatric oncology was a great opportunity to do all of these things. I'm able to work with children and families. We're able to tackle difficult diseases and really act as a support for these families. I was a little intimidated with the idea of coming to Johns Hopkins because of its reputation and how strong the researchers are here, but I was pleasantly surprised with how friendly and how open everyone is here. Our attendings have been very supportive of the fellows, including our program director, and my research mentor has also been very supportive, so I was able to come into the lab with little experience and do very well. So I chose to come to Hopkins because it was such a unique opportunity to have very strong clinical exposure. The Children's Center has a great oncology program, along with other ancillary programs, so it's really an interdisciplinary approach, a really multi-team approach here at Hopkins. And then on the research side, there are also amazing opportunities at the Cancer Center. There's also opportunities through the School of Medicine and the School of Public Health. Here at the Children's Center, we see a variety of complex patients and really have a multidisciplinary approach to our treatment. On the research side, we have great opportunities for research at both the Cancer Center, but also the School of Public Health and the School of Medicine. So coming to Johns Hopkins was a great opportunity to have strength in both clinical and research. I've really enjoyed the patient care that I do over at the Cancer Center. I've created a really great bond with my patients and their families. I've really enjoyed being part of their treatment team over the past few years. I've also really enjoyed my research experience over at the Cancer Center. I have a great mentor that I've worked closely with. There are other postdocs and other researchers in the lab, and I've really been able to develop myself as a physician scientist, and I've really enjoyed the project that I've been working on. So I came to Hopkins a little bit unsure about what I wanted my clinical and research focus to be. The program was very supportive with giving us a variety of options and allowing us to meet with many mentors. I was able to pick a mentor who also gave me some independence in picking a project. So there was a lot of flexibility in finding a clinical and research focus. The program additionally gave me the flexibility to pursue a PhD over with the School of Medicine to complement what I was doing in the lab. So overall, the program has been very supportive of fellows choosing their clinical and research path. My co-fellows have been extremely supportive throughout this process, but they've also been a lot of fun to be around. We've had a great time celebrating the highs during fellowship, but also some of the lows, and we've really been a support system for each other.